Hello guys, so today we are going to discuss on milk fever in dairy cattle, also known as pasturin-paralysis or hypocalcemia. So hypocalcemia is nothing but acute to peracute afebrile flaccid paralysis of mature dairy cow that occurs most commonly just before or after pasteurization. It manifests in change of mentation, generalized paralysis, and circulatory collapse. So pasturin-paralysis has some widespread effect that predisposes uh, carving problems such as retained placenta, uterine prolapse, metritis, mastitis, ruminal status, and depression of immune system. And this all will cause a reduction of productive life by 3 to 4 years or death if left untreated. So these conditions are predisposed by hypocalcemia. So what is the etiology of hypocalcemia? During pasteurization or near the time of pasteurization, what happens is the calcium output increases because the calcium is secreted in the colostrum and milk, and calcium mobilization decreases from skeleton, and calcium input decreases from intestine. This all leads to hypocalcemia. Serum calcium level declines from a normal of 10 to 12 mg per deciliter to 2 to 7 mg per deciliter, and serum magnesium is increased, serum phosphorus is decreased. This all will cause instability to maintain calcium homeostasis, and this all will result in abnormality of transmission of nerve and muscle impulses, which all will result in pasturin-paralysis or milk fever. Actually, fever is the misnomer condition. We do not see any increase in temperature. Actually, we see the decrease in temperature. So, how normal calcium levels are regulated? So, blood calcium level decreases. If it decreases, it will stimulate the release of parathyroid hormone, which will cause osteoclasts to stimulate and break down and transfer the calcium from bone to blood. It also targets kidney. Parathyroid hormone also targets kidney, which will cause activation of 125 dihydroxy vitamin D3, which will release from kidney, and it will absorb more calcium from the rumen, and this will lead to increase in blood calcium. So this is how calcium in blood is regulated and homeostasis occurs. So what is the physiological role of calcium? Maintain the safety of the skeletal, control of biomechanical processes, whether it is intracellular activity of the large number of enzymes, transfer of information from surface to the interior of the cell. That's why calcium is very important for extracellular purposes like muscle and nerve function and blood clotting. So what are the risk factors associated with hypocalcemia, or what are the risk factors for the hypocalcemia? So first of all, we'll come on to the age. So what happens is during 3rd to 7th pasteurization, as the animal becomes older, the kidney response to parathyroid hormone decreases, which causes decreased production of vitamin D3, which will cause decrease in efficiency of intestinal absorption of calcium. Means calcium will be absorbed in less quantities as the age increases. And due to increase in milk production, calcium demands will increase obviously because the calcium is lost in the milk. What happens as the age increases? Osteoclast response also decreases towards parathyroid hormone, which will cause decreased ability to mobilize calcium from bone storages, and thus efficacy of bone reabsorption decreases. So breed. Crossbreed are more susceptible to pasturin-paralysis than local breeds. Due to high milk yield in crossbreed and loss of more calcium is occurred in crossbreeds, and there is a low ability to maintain calcium homeostasis. Coming on to breed, Jersey cows are more susceptible towards milk fever than Holstein cows. So we can say that there is a genetic predisposition of milk fever or hypocalcemia. uh, Coming on to dietary factors, high calcium intake during the dry period will cause decreased activity of the parathyroid gland. This decreased activity of parathyroid gland will cause uh, absorption of calcium and from GIT, which will decrease due to decreased level of parathyroid, and bone reabsorption will also decrease. So these two factors will cause failure to meet the increased demand of calcium during parturition and after parturition. So high phosphorus intake during the dry period causes blood phosphorus concentration to increase. Therefore, renal synthesis of the vitamin D3 decreases, and this vitamin 3 decrease will cause intestinal calcium absorption mechanism to go down, and therefore hypocalcemia occurs. High levels of estrogen around calving inhibit calcium mobilization, and high potassium or high sodium, which are mostly seen during consumption of excess lush green pastures. So what happens is this leads to metabolic alkalosis, and the metabolic alkalosis leads to decreased activity of parathyroid gland. Low magnesium intake. So what happens? Impaired release of parathyroid hormone in response to hypocalcemia, and decreased tissue sensitivity to parathyroid hormone in hypomagnesiemic states. So coming on to clinical signs. Before coming on to clinical signs, we should discuss about the theories of hypocalcemia. Certain theories are there why hypocalcemia occurs. So in the theories we will discuss one by one. So first theory is hormonal theory. Second theory is receptor theory. Third theory is DCAB, which stands for dietary cation and anion balance. So we will discuss one by one what are these theories. So coming on to hormonal theory. So failure to secrete parathyroid hormone and vitamin D3 leads to hypocalcemia. But this is the old concept. Now we can see by further research that cows which are suffering from milk fever either have normal or high levels of parathyroid or vitamin D3. So coming on to the receptor theory. Receptor theory states that as the age increases, the receptors doesn't work much for absorption of calcium. So coming on to DCAB theory means dietary cation anion balance. So if cations are more, so it will cause metabolic alkalosis, which will decrease the absorption of calcium. And if the anions are increased in the diet, it will cause metabolic acidosis and the calcium absorption will increase. So coming on to clinical signs. So parturition paresis in dairy cattle around calving can be divided into three stages. First is ambulatory stage, means the animal is still standing. It is also called stage of excitation. Second stage is sternal recumbency or lateral recumbency. As you can see in this picture, this is ambulatory stage. This is stage of sternal recumbency, or it is also called lateral kink. And this is the last stage, which is also called lateral recumbency stage. So coming on to transient stage. In this stage, what happens? Cow with early sign without recumbency, it will cause hypersensitivity and excitability due to disruption of the membrane calcium, and further leads to hypersensitivity of the muscles and neurons. So we can see the shaking of the head and bellowing, Mildly ataxic and easy to fall cow can be seen. So coming on to sternal recumbency stage, uh, stage 2 can continue from 1 hour to 12 hours. Depression and partial paralysis can be seen. Sternal recumbency and head turn to the flank, which is also called lateral kink, can be seen. Temperature is subnormal. As I told you, that in milk fever there is no fever. Actually, the temperature goes down due to decrease in calcium levels. A decrease in calcium level causes atony of the smooth muscles. So here we can see that muscle will be dry, coldness of the skin and legs can be felt, and heartbeat will be rapid and exceeding 100 beats per minute. We can see the gastrointestinal atony, which causes constipation and mild bloating. So in second stage, we can see that there is mild bloating. So coming on to lateral recumbency, cows are flat out, means there is bloat is occur, means they are on their lateral side, and we can see the completely paralyzed cow. Depressed and progressive loss of consciousness can lead to coma, and fall in temperature is continuous. Heart sounds become nearly inaudible, and heart rate increases up to 120 beats per minute. Cows will not survive more than few hours if they are not treated. So coming on to diagnosis, how we can diagnose a case of milk fever. So we can see history. History means what breed of the animal it is. If it is Jersey breed, we can see that it is more predisposed towards milk fever. We can see the clinical signs in excitability is there or not. Is it near parturition, or parturition recently occurred, or we can see the animal is on sternal recumbency, having the lateral kink, subnormal temperature, like that we can see. We can collect we can collect the signalement, which is the age of the dam. Is it in the 3rd to 7th lactation stage, so which is predisposed towards milk fever easily. Or what we can do is we can see the response of intravenous calcium borogluconate solution. If it is having improved condition after treating with intravenous calcium, then we can diagnose it is a case of hypocalcemia. So we can estimate calcium. So normal calcium levels are up to 8.5 to 10 mg per deciliter in stage 1, which is ambulatory stage, and the animal is still standing. The levels are 5.5 to 7.5 mg per deciliter. In stage 2, it comes down to 3.5 to 6.5 mg per deciliter, and in stage 3, it can be as low as 2 mg per deciliter, which should be corrected rapidly. We can also see the serum muscle enzymes such as creatine kinase. In milk fever, it may increase up to 1000 international unit per liter, and also the AST levels can reach up to 500 IU per liter. We can also estimate serum phosphorus. In milk fever, it may come up to 1.5 to 3 mg per deciliter, and magnesium levels can come up to 4 to 5 mg per deciliter. Normal levels are 1.7 to 3 mg per deciliter. So in milk fever, the blood glucose level can also be estimated. It may be normal, or it is less than 30 mg per deciliter. So coming on to differential diagnosis, how we will differentiate diagnose a case of milk fever. So we can see that in such conditions, other metabolic diseases such as ketosis can be seen. A case of hypophosphatemia can be seen. In case of hypophosphatemia, we can see that red urine, which is nothing but hemoglobinuria, can be seen. In case of hypomagnesemia, we can see that animal is having excessive mentation or excessive sensitivity, and hypokalemic can also be differentially diagnosed by milk fever. Diseases associated with toxemia and shock, like acute or peracute mastitis, aspiration pneumonia, peritonitis, acute carbohydrate engorgement, and septic meningitis. Injuries related to pelvis and pelvic limb, like radial nerve paralysis, hip dislocation, rupture of gastrocnemius muscle. In all this condition, animal will be in recombinant stage. Either it can be sternal recumbency or lateral recumbency. So we have to differentially diagnose the diseases accordingly. It can be a degenerative myopathy or Downer cow syndrome, which is a sequelae of milk fever. So coming on to treatment, what treatment we can suggest? So treatment plan depend according to the stage of the milk fever. So what we can do is we can administer calcium propionate by oral route, which is the best approach towards hypocalcemia, in which the cows are still standing. What we can do is we can give a 0.5 kg of calcium propionate, which we shall dissolve in 8 to 16 liters of water and can be given per orally. Or we can go for subcutaneous injection of 300 ml of calcium borogluconate. Cows in second and third stage of the milk fever should be treated immediately with a slow IV administration of calcium borogluconate at the rate of 1 gram per 45 kg of body weight calcium. Or you can supplement meanwhile with calcium borogluconate, phosphorus, magnesium and glucose, which is more than sufficient to correct the whole deficit whole cow's calcium. What happens is approximately 75% cow stands within 2 hours of treatment. Animal not responding by 4 to 8 hours should be retreated, and the cows which respond initially, 25-30% relapses within 24 to 48 hours and requires additional therapy. So what responses we can see when we administer calcium borogluconate? So what we can see is we can see the tremors, we can see improved cardiac output, and we can see the atony results of smooth muscles, and we can see that erectation is seen, or voiding of the urine is seen, and the cow rises up. One precaution should be taken while administering calcium, because it is cardiotoxic. While administration of the calcium slowly 10 to 20 minutes, we should do auscultation. Meanwhile, if there are dysarrhythmias or bradycardia develops, administration should be stopped until the heart rhythm has returned to normal. Some cows that have been comatose may have regurgitated and inhaled ruminal content. So what we can do is we can provide antibiotic treatment as soon as possible to avoid the inhalation pneumonia. So recovered cow should not be milked for 24 hours because if you milk again, calcium loss will be occur, and again it may become hypocalcemic, and again the signs can be seen. So after treatment, we should not milk the animal up to 24 hours. Then the amount of milk should be gradually increased over the next 2 or 3 days. It should not directly increase after 24 hours. It should be gradually increased. So how we can prevent and control the case of hypocalcemia? So feeding low calcium rations during the last week of pregnancy, what it will cause is diets in low calcium during the dry period will increase the activity of parathyroid gland, which will cause increased renal absorption of calcium. It will stimulate calcium reabsorption from bone, and it will stimulate renal vitamin D metabolism, which will cause low incidence of milk fever. What we can do is we can provide acidifying ration by providing anionic salt supplementation. What it will cause is it will cause metabolic acidosis. In this metabolic acidosis, what it will cause is it will cause increased parathyroid gland activity. Thus, it will make the animal resistant towards milk fever. We can give prepartum vitamin D3. A single parental dose of 10 million unit per cow IM 2 to 8 days before parturition can be given. We can provide oral or parenteral calcium supplement around parturition. So what we can do is 50 gram of calcium salts like calcium chloride and calcium propionate can be administered as bolus gel, paste or liquid 12 to 24 hours before parturition and continuing it to 24 hours after parturition. We can provide intravenous or subcutaneous calcium gluconate or borogluconate solution to cattle around parturition to avoid the milk fever condition. Other strategies like partial milking, like reduced milking in the early lactation can also be done. Dietary magnesium level can be controlled during peripartum period. A body condition should be controlled. It should not be too thin or too obese animal. Thank you.